We are here with our second webinar. This is, yes, Bikram? Bikram, can you hear me?
Yes.
Yeah, this is our second webinar. And like first, we did it last week, and many people have said they wanted to hear more about the frontline cases of COVID-19, how to how to diagnosis and treatment and what happened in Wuhan. So we requested one of our expert. Her name is Professor Han Yi. Like most of the people they joined last time, they already knew about her. So we have requested her to have a presentation today. So she will be talking on behalf of Frontline Experience on the diagnosis and treatment in Wuhan of COVID-19. So before that, we have some procedure. So we have our host, Jessis, Nepal Jessis, and also we have my friend here, Kalpana Shrestha. She is the president of Buddha Nilkantha Jessis. And we also have Gyan Krishna Dai. He's a charter president of Rotary Club of Makwanpur. So they are also part of us. And Internet Society, we have Bikram here, who will be helping us for our technical support. So I would like to hand over the mic to Kalpana. I think, Kalpana, shall we start now?
Yes, we can.
Oh, that's a nice song. Yeah, go ahead.
Just my phone is coming. Just 1 minute.
Hello. President जी 1 minute गर्नु न.
Can you hear me, everyone?
Yeah, I can hear you.
Thank you, Roshan. A leader is one who knows the way, goes the way, and shows the way. So the doctors are the leaders for this pandemic. We are very happy to welcome all the delegated participate for our today's virtual interaction session. Frontline Experience on Diagnosis and Treatment in Wuhan with Clinical Cases of COVID-19 by Professor Hani. I would like to welcome our National President 2020, Senator Ashok Shankar, delegated for Area C, assigned VP, EVP JC Gokul Sapkota, Area C Individual Sector EVP JC Lanmani Bhandari, National VP Area C, assigned for Area C, JC Shiva Prasad Bhushan, National Training Coordinator JC Sagar Bhatta, Training Commissioner JC Shiva Subedi, and also I would like to welcome Dr. Saroj Gaudel. Please accept my warm greetings. It's me, JC Kalpana Shrestha, President JCI Buralin Kantha 2020. This year, 2020 might not be good for all and might not be best circumstance, but let us look at the brighter side of today's. 2020 year is declared as a year for nurses and doctors that we can see how they are facing and supporting to all who are affected by COVID-19. Saying this, me and my all board members would like to welcome our program's chief guest, National President 2020, Senator Ashok Shankar, to have your valuable words by welcome greetings for today's virtual interaction sessions. Over to you, Senator Ashok Shankar.
Thank you so much, President JCI Buralin Kantha. First of all, I would like to show my gratitude to Dr. Hansi, Chief Physician, Professor, PhD Supervisor, for your presence and sharing knowledge about the COVID-19 during this pandemic time for the webinar. अनि स्पेशल थ्याङ्क यू भन्न चाहन्छु लोकल च्याप्टर बुढा नीलकण्ठ र अहिलेको सिचुएसनमा जति पनि प्रब्लमहरू आएको छ मलाई लाग्छ यस विषयमा विश्वमा दबाई जुन मेडिसिन नबने पनि अहिले सबभन्दा ठुलो च्यालेन्जिङ भनेको अवेरनेसको रहेको छ र यस अवेरनेसको लागि जुन डाक्टरहरूको टिम जुन वर्ल्ड वाइड जति पनि काम गरिराख्नु भएको एक्सपिरियन्स डाक्टरहरूको टिमलाई लिएर यहाँहरूले जुन वेबिनार मार्फत एउटा चाहिँ सचेतना जगाउने काम गर्नुभएको छ यसको लागि आभार प्रकट गर्न चाहन्छु जेसीआई नेपालको तर्फबाट र मलाई लाग्छ यसको सबैभन्दा हामी जस्तो सोसियल वर्क गर्ने संस्थाहरू र सोसियल रूपमा एक्टिभ सिटिजनको रूपमा रहेको युथहरूले नै अब यसको चाहिँ सबैभन्दा बढी इफेक्टिभ काम यसको विरुद्ध सबैभन्दा बढी इफेक्टिभ काम गर्न सकिन्छ सबभन्दा प्रब्लम के हो भने हामी यसमा अवेरनेस हुन सकिएन यसलाई केयरलेस गरियो भने यो सबैभन्दा ठुलो च्यालेन्ज हुन्छ विश्वको लागि र अहिले जति पनि भ्याक्सिन नबनुन्जेलसम्म जति पनि यसको चाहिँ राइट चाहिँ मेडिसिन नबनुन्जेलसम्म हामीले सोसियल डिस्टेन्सलाई कायम राख्ने हेल्थ कन्सियसमा अलिक बढी अवेरनेस हुने कुरालाई हामीले ध्यान दिनुपर्छ र आजको यस कार्यक्रमको सफलताको शुभकामना दिन चाहन्छु वन्स अगेन वेलकम टु हान्सी डाक्टर हान्सी थ्याङ्क यू सो मच
Thank you. Thank you, JC Senator Ashok Shankar, for your valuable words for welcoming to all our delegated participate. And this thank you, National President, for your valuable words by welcoming to all the participants. I would like to hand over mic to Dr. Rosen. Please continue.
Thank you. Thank you very much. Thank you, JCI President, Senator Ashokji. It was really encouraging, and like you have spoke about the current scenario. Not everyone, like everybody around the world, everyone is facing this pandemic, and yeah, that's why one of the reason why me and Bikram and we all decided that as I have access, because I have been working in China for a pretty long time, and we have the professor who have been fighting COVID in the front line. So I wanted to take that opportunity, sitting at home and guiding our doctors over around the world. And as you know, the coronavirus started from China, and especially in the Wuhan. It started, and they were in lockdown for around 76 days, and now they are normally back to life now. So that is one of the plus point, and we have to learn from those countries, I believe. So there's always not too late, because as we have the less cases right now, and it doesn't mean we are safe. We are still, the cases are increasing day by day. So that is one of our concern, that we have to prepare our medical practitioner in the front line for the disaster. So this, due to this consideration in our mind, so we started doing the webinar. And last time we had 3 experts, and out of that, Professor Han Yi, who was fighting in the front line, she agreed to have this webinar with us and her experience with us. So that is the reason. So we said, okay, we'll do her solo performance of presenting her cases, what she faced. And I hope we won't have that kind of cases in Nepal. But we do have a participant attendees from different countries who is also facing this pandemic very seriously. So I think I'm pretty much sure that it will be helpful for our attendees. So before that, Bikram, can you just tell me the technical thing, like how this gonna be conducting this time? Bikram?
Thank you, Rosen. Just give me a second. I have prepared a small presentation. So how we are going to go forward. So first of all, welcome to all in this webinar. This is one of the second initiatives we made for all participation, whoever working in a frontline area or in hospitals. Especially this program is designed for our doctors. So welcome all Nepal Justice President and Vice President, Executive Vice President, and I have already shifted to panel and co-host to Dr. Han. Welcome, Dr. Yan. So our main schedule for this webinar is just before the Rosen has already started the program, and he's the moderator for the program, and the president Kalpana Shrestha, the JCI Burankantha, she had already given open space and welcome remarks. So I'm giving some housekeeping and background of a webinar. So how this webinar we are going to conduct. After this, from 11:45 to 12:45 to 50, the national president Senator Ashok Shankar has already given his welcome remarks to all of our participation, and keynote speaker already had joined in our session, and from keynote speaker 12:50 to 1:20, 1:25, she will be giving the expert presentation on her experience and best practices she had done in her area. So, and after we have a discussion and a follow-up questionnaire from the participant and research person. That's in 12:25 to 1:45, and then there is some summary discussion by Dr. Saroj Gurel from 1:45 to 1:50. Then after the program remarks by Vice President of Nepal JSIS, Shiva Prasad ji, and then we have a closing remarks. So this is how we are going to schedule our webinar. The list of topic that we covered, that we have already how to participate in webinar, how can access the YouTube link, and how webinar functions and guidelines for the participants. So organizer has already forwarded to the participants and YouTube link. Who cannot access in Zoom, they can join in the YouTube link. We have already shared, and because of Zoom has limited seats, and we have created a broadcasting from YouTube. The host has access to view who has joined and left the webinar, and provide access to those who want to talk and participation in Q&A session. So how functions this webinar? Webinar is simply a live virtual training where experts present training, can share training slide materials. Dr. Yan He is only the expert speaker for today. Participants can talk with the trainers directly and when required, but we'll recommend to participate in after this her sessions. So guideline for participation is we personally request that please attend all the full webinar. So please click raise hand on your screen, and then host co-host allow to talk for the whoever want to have a questions. And then the main reason for the mute and instruction is because it will create disturb due to host background noise for from participation. That's why we ask all participants to mute their mic, and participants are requested not to ask any confidential information. Further, expert trainer doctor also requests not to share confidential information via voice or slide or training material. This is done just to secure privacy of individual. We are working totally in online. That's why if there is confidential material, we are asking everyone to make a confidentiality. Then from my heart and from the organizer team, hats off to all doctors, whoever working in frontline and background nurses. So this picture shows us that definitely this is a hard time for doctors and nurses, whoever working in the frontline. That's it. Thank you very much. And happy National ICT Day. Today is National ICT Day in Nepal. I want to wish all Nepalese and international guests, whoever are in this webinar. So happy National ICT Days. Thank you very much. Dhanyavad. Over to Roshan. Thank you.
Thank you, Vikram. Thank you very much. And we have our guest here already. So Professor Hani is there live. Hello, Professor Hani. How are you today?
Hello. How are you, dear host?
Yes, thank you very much. I know you are still in quarantine, and thank you very much for your time. We really appreciate that. Can we start? Professor, are you ready?
Yeah, sure.
Yes, please go ahead. Over to you.
Okay. Thank you so much for the invitation and the introduction. I'm very glad to have this opportunity in this webinar. Okay, I need to share my screen first. So is my screen online right now, Dr. Roshan?
Yes, we can see it. Yeah, please go ahead, ma'am.
Good. Thank you so much for the introduction and the welcome. This is Dr. Han Yi from the first affiliated hospital of Nanjing Medical University. I was previously a frontline doctor in Wuhan in the combat of COVID-19 disease. And today I'd like to share my experience with you. If this is going to be of any assistance to any of you guys, I would be very much delighted. Okay, for the past 2 months, like from 13th of February to April, 13th of April, I was in 2 hospitals in Wuhan. At first, it was the first civil hospital. It has totally 1,000 beds open for COVID-19 patients. And later on, I was sent to the famous Jinyintan Hospital in Wuhan. It was previously an infectious disease hospital. It has only 800 beds, but it totally received 2,860 patients, and more than 66% of them were severe and critical cases. But finally, we have managed that 88% of them recovered and being discharged, only 320 deaths. That was really marvelous history, and I was glad I was part of it. This is my wonderful doctors team. I love each and every one of them. We have been fighting all together for the past 2 months. We supported each other, watched each other's back for the whole procedure to be as safe as possible, not only for the patient, but also for ourselves. I was very glad, I'm actually very grateful that we could come back home safe and sound all together. I shall never forget about such experience that was very difficult, very unforgettable. Okay, now here are some pictures that me and my colleagues were in working status, doing catheterization and resuscitation for another patient. The patient finally did not survive COVID-19 because he actually developed severe myocarditis and cardiac shock. During his situation, his heart did not respond to all sorts of resuscitation medications like catecholamines, adrenalines, noradrenalines, even dopamine and dobutamine, or even atropine. So we were not able to bring him back. Such cases happen very frequently during the hard times. And beyond this, at first it was actually a regional outbreak, but later on it rapidly grew up into a global pandemic. It has took quite a lot of our dear colleagues and medical workers away. That was really heart-wrenching. Okay, now let's take a brief look at this pandemic disease. According to the statistics by Johns Hopkins University, up to April 24th, this COVID-19 has got 2.75 million hits and has killed like 190,000 people. And of course, most of them, more than 80% of them, were mild and moderate cases. Just 19% of them needed oxygen support, and only 5% of them needed ICU care. Well, this virus actually belongs to the Beta genus. The shape should be round or oval, and it is sensitive both to violets and to heat. So 75% of ethanol and chlorine containing disinfectant should be able to inactivate this virus, but chlorhexidine cannot. The source of the infection, including infected people, all the patients, and even with or without symptom. The major route of transmission usually is through respiratory droplets or close contacts or even aerosol transmission. People of all age are generally susceptible to this virus. Although this may be people of younger age could be having relatively mild or moderate symptom, but the patient over 65 years old, nearly half of them needed critical care and needed to be sent to ICU. Okay, this is the typical timeline of a critical case. Usually, at the 7th day of the onset of the disease, the patient should be sent to hospital because of their severe symptom, and later on he might develop symptoms like dyspnea or even ARDS. That's what we call acute respiratory distress syndrome. And even later, he might require invasive or non-invasive ventilation. So such patients should be sent to ICU. If lucky enough, within 2 to 4 weeks, these patients could be recovered and discharged from the hospital. But if not, well, you know, the comorbid conditions always include old age and cardiovascular disease such as hypertension, CAD or COPD, sometimes diabetes, sometimes renal disease, or sometimes obesity. We have statistics that male sex tend to have more COVID-19 than female sex. So what deserves a mention is that obesity tends to be a comorbid condition. You guys all know that at first, Prime Minister Boris Johnson, when he got hit by COVID-19, we were actually predicting that he might be a severe case because of his body weight. And later on, it has been proved out, yeah, he was a severe case and he was even being sent to ICU. Okay. To understand disease, we must totally understand its pathophysiology. However, it still remains a mystery to us of this COVID-19. Like I did before, many ER and ICU doctors still, or maybe previously questioned the treatment protocols and the timing of ventilation or the usage of ventilator in such COVID-19 cases, because such patients may not respond to high levels of PEEP, but they may respond to high levels of oxygen flow. So there is a theory, it's just a theory, maybe a hypothesis. I wouldn't totally agree with this, but it certainly explains something, some phenomena in this disease. It says this virus might attack hemoglobin, dissociate this hemoglobin, removing iron from it and change it into porphyrin. We had previously an autopsy findings that the lung tissue of COVID-19 patients that have quite severe coffee-colored secretions and or even mucus plugged in the bronchi and alveoli. And COVID-19 patients tend to have very low oxygen saturation. So this theory might partially explain this, but it cannot explain why chlorhexidine cannot attack this disease, why blood transfusion, especially red blood cells transfusion, cannot save such patients. So this mechanism may not work well. Well, we still have another theory, maybe from cardiologists. They say this virus may directly attack the lining of the heart and blood vessels, and hence the downstream cytokine storm. It's really true. Scientists have already proved that this virus could combine to these SEE2 receptors in the human body and then trigger the downstream cytokine storm.